one, it looks like there's some new reporting regarding nursing homes, and it would increase the total by about 1,700 in terms of total deaths. Does that count towards the official tally, or are they in a different category? How's that being reported out?
You have, I'll ask Jim or Melissa to explain this, because I don't know the details, frankly. You have two categories: confirmed deaths, and then probable or presumed deaths. And they list numbers in both categories. Some people combine the two, confirmed deaths and presumed deaths, and have one number. Some people keep them separate, and then they're often reported separately or they're reported together. But that has been going on for a while. But Jim, is that accurate?
That's accurate, Governor. Like we've reported in the past, we asked the nursing homes to provide updated information. They originally provided about 3,100 total deaths. The confirmed deaths of those are actually 2,100. That gets added to the official count. We are counting both the presumed and confirmed, but the confirmed deaths are the one we're running in the official tally. Other localities are submitting unconfirmed deaths, but we want to confirm those things as much as we can. But now we're putting up both categories so people can clearly see, because some of the facilities were reporting both together and it was difficult to tease out. So we've asked them to report clearly that line of both confirmed and presumed.
And specifically, Isabella Geriatric Center, which is something we drew attention to this week, they issued a statement saying there had been 98 deaths, but the official reporting shows less than that, something in the 60s. Does it not count hospital deaths? In other words, if someone goes from a facility to a hospital, is that then counted differently?
Those get reported in the hospitalization deaths. The Isabella situation, they reported 60, but in actuality, it's 21 confirmed deaths and the remaining being presumed, which we'll have to officially try to confirm one way or another. So it is in line with keeping with what they were sending before, but we've asked those facilities to update, which they have.
Also, Zach, just to be clear, I would take all of these numbers now with a grain of salt. Look what you're saying. The confirmed deaths, you know what that means. What does a presumed death mean, right? We presume it. How do you presume it to be coronavirus? Also, the at-home deaths, non-hospital, non-nursing home deaths, just at-home deaths, when do you actually get all the numbers on those, and how do you confirm all those deaths as attributed to coronavirus? So I would just have a caveat with all of these. I think they're going to change over time.
Governor, when you look at these nursing home deaths, why weren't steps taken earlier to protect such a vulnerable population? As you look back now and knowing that this virus is going to be around for a while, are there things, there are mechanisms that can be done differently so when people are sick in the nursing homes, they go to the hospital and stay in the hospital?
Well, go in the hospital and stay in the hospital. Well, first, your basic point is right. The nursing homes, we said from day one, are the most vulnerable place because it's old people, senior people who are the vulnerable population in a congregate setting. And that's how this nation was introduced to the virus with the Seattle nursing home, right? So, and it was true around the world also. What can you do better going forward? I don't know. It's something we're studying. We're also doing an investigation with the Attorney General to look at it. We did some very harsh things here that frankly I wasn't even comfortable with, but the health experts insisted. No visitors to a nursing home for 2 months, no visitors? How do you do that? Because all it takes is one person to walk in, test the staff, PPE, you do everything you can. But if there's anything else we can learn from and do, we will do. You have people who get sick in the nursing home. Sometimes they're transported to a hospital. That's up to the experts in the nursing home, if that's helpful. If they're in the hospital, we also need hospital beds, right? It's not like we can turn hospitals into nursing homes. Once a person is better, the person has to go somewhere. They don't have to go back to the nursing home, by the way. The way the nursing home operates, they make a determination if they can provide the best care for the person. If the nursing home says, I can't provide care for this person, then the nursing home must transfer the resident or call the Department of Health and say, this person should be referred somewhere else. I can't take care of this person. We have COVID-only facilities that can take people from nursing homes. The nursing home has to make the decision. So if the hospital calls and says, I want to send back a person who had COVID but is now better to the nursing home, if the nursing home doesn't think they can take them, they shouldn't. And all they have to do is say no and tell the Department of Health, and that person will go somewhere else. So it really comes down to that nursing home has to know what its limits are, who it can provide care for, and who it can't provide care for, and we have alternatives. But we have to get it from that nursing home first. Melissa, do you have anything to add on that?
No, actually, Jim, do you want to speak to that?
I think the governor said it. We've had really aggressive measures in New York State. No visitors from the outside was a pretty aggressive measure. 12-hour temperature checks on all staff, PPE requirements for all staff. And as the governor said, the rules from the federal government and the state are clear. You have to do separate cohorts for COVID positive versus COVID negative, not only for the residents, but also for the staff. And if you cannot do it, the regulations state specifically, NYCRR 487.4 and 488.4 cannot admit residents who are symptomatic unless the facility's licensure and certification require on-site clinical staff capable of attending to the medical needs of symptomatic COVID residents pursuant to the instructions. So it's clear, and we've made many facilities available for COVID only. It's up to the facilities to call us to make sure we can make that transfers happen.
And what do nursing home staff do if they're not able to get PPE in the nursing home?
We've been working directly the state. This is a residential requirement for the facility themselves, but facilities that have had difficulty, we have provided hundreds of thousands, if not millions, of PPE to nursing homes all across the state, including downstate. Hundreds of thousands of gloves, hundreds of thousands of goggles, face masks, gowns. So we've been working to backfill something that's not actually a requirement of the state to do, but given the crisis, we have been providing that that material as well to those facilities.
But also, just if I may make one point, you know, everybody wants to point at the nursing homes now. We knew the nursing homes were going to be a target, and whatever we do, they will be a target. Those nursing homes, and I've spoken to a number of them and staff, they are doing phenomenal work. We lost 230 people yesterday. We didn't lose 230 people to coronavirus because we didn't do everything that we could do. We have the best healthcare system on the planet, I believe, and our people are doing everything they can do. We have the equipment, we have the staff, they're doing everything they could do. Still 230 people died. In a nursing home, that coronavirus, if it figures out a way to get in there, and all it takes is one person, one staff person who doesn't have a temperature, who's not symptomatic, one facility person, one person who comes to work on the air conditioning system. All it takes is one person to bring that virus in there. And you do everything you can, but at the same time, you can't do everything, right?